Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm very pleased you could be with us during this next segment. The distinguished Dr. Clarence Nicodemus. Dr. Nicodemus, thanks very much for being on the program.
Oh, thank you for the invitation.
Dr. Nicodemus, you are practicing here in Monterey.
Yes.
And you have privileges right here at the hospital in Monterey.
Yes, correct.
And you are a doctor of osteopathy, DO.
Yes.
And a PhD.
Correct.
Again, I get intimidated when I have these brilliant doctors on my program. So, Dr. Nicodemus, let's talk a little bit about your training and getting through osteopathic training. And I also want to learn a little bit about your biomedical engineering and mechanical engineering background. You have a PhD. So can you tell us about your education and training?
Yes. Initially, it was in engineering. I went through a bachelor's and master's degree in mechanical, then went off into the Army, tour in Vietnam, and so on. Came back and did a PhD in what was termed biomedical engineering at University of California, Davis. And the focus was on biomechanics. Actually, we call it orthopedic biomechanics because it was on the function and structures of the human body.
Okay, so you got a PhD in 1993 in biomedical engineering at UC Davis.
Correct.
Okay, and you got your medical degree in 2004, and now you're board certified in neuromusculoskeletal medicine.
Correct.
So just give us a summary of what your week is like. What's your practice like in the office?
We see people, mainly the adult population, but we also I've seen infants and children as well, who have, I guess you globally call it musculoskeletal issues. They could be aches and pains, or they could be dysfunctions. In the younger population, parents are worried about, well, my child isn't, walking just right. There's maybe some curvature of the spine. Can we do anything about this? The older population, it's aches and pains. It has to do with, a lot of them are low back pain, so-called, but there are also knees and ankles and things that oftentimes elude the usual approach to treatment. Okay,
so you are in private practice here in Monterey.
Yes.
And as I mentioned, you also have hospital privileges.
Correct.
At community hospital. Okay, so Dr. Nicodemus, our topic for today, incredibly common low back pain.
Yes.
Can be incredibly debilitating. During the segment change in between, I mentioned to you, about 8 weeks ago, I was picking up a bag of cymbals. I'm a drummer. I leaned over and I felt a twinge in my back. Mm-hmm. First time in my life, I had low back pain for about 2 weeks. Unbelievably debilitating. I could not believe I couldn't do a thing. I mean, getting in and out of bed was just painful. So, and you sent me some material that says low back pain is the second most common symptom or problem after the common cold, why patients seek medical attention.
Correct.
It's unbelievable. So why is that? Why do so many people feel and experience low back pain?
Well, I think the term low back pain needs to be expanded from what we typically visualize or hear. The term itself, low back pain, needs to be expanded to include the pelvis and its muscular and skeletal components, which support the back and its function. So when you take all of that territory into account, and the fact that any lifting, carrying, sports activities, long-term episodes of sitting, as being in school, studying, so on and so forth, or at home, it will cause imbalances in muscles, and things start to hurt. The muscles don't function properly. They're less strong than they used to be. They don't support the whole structure. So pain, dysfunction will creep in. And whether it was an injury, as in a motor vehicle accident, or a fall or something, or in a sports injury, or whether it's through, let's say, disuse, little use of the muscles and the structure. Regardless of how it occurs, it's painful. And the pain ranges from a little bit to a whole lot, and from a few days or weeks to years. And that's the enormity of the problem.
Okay. Well, Dr. Nicodemus, I think typically, or one way that we conceive about low back pain, of course, the spinal cord is the largest nerve in the body, goes all the way down from essentially from the brain and through the neck and down through the center of the back, surrounded by the vertebral column, and down into the tailbone, almost there. And we think of the disc problem or vertebral body problems, but it sounds to me like you think of the low back pain, especially in terms of the pelvis. It's a whole structural, musculoskeletal concern, and it's not just the spine, correct?
No, in fact, if you look at the frequency of the types of back pain that are treated, those dealing or emanating and caused by or involving the spine are one of the fewest, actually. The most common has to do with the ligamentous structure, the things, the basic glue that holds the joints together. They get sprained, the muscles get strained, and those are the lingering problems. And it's more common to have those type than it is to have something like a nerve impingement or a disc bulge that pushes into the nerve space.
Well, Dr. Nicodemus, that's a great segue to my next question. Is how do you tell, or how can you distinguish a nerve pain, say if there's a disc problem pressing against a nerve, from, say, what we used to call, or maybe some people still do, use that term lumbago or lumbago, which is really a lower back strain. Isn't that correct?
Well,
so how do you distinguish between, say, a musculoskeletal strain and a nerve problem?
Well, that's where the history and physical examination comes in. You must be very careful in understanding how the person got to the office. In other words, what occurred. What are they feeling? Where are they feeling? Is it pain? Is it numbness? What specific muscle areas, skin areas are involved? And then you go through a series of very specific tests that look at those particular areas. Is this or that muscle involved? Is this joint involved? Is there something about the capsule, the ligament around the capsule involved? So there's a whole battery of tests that you go through. And through all of that, it's basically an engineering analysis, strangely enough. And you come up with a very precise definition of what the cause is.
And so once you determine the cause, then that's, of course, going to dramatically affect your treatment recommendations or your treatment protocol.
Correct.
So let's talk about low back muscle strains, right? I think what people sometimes call lumbago or lumbago. How do you typically treat a person who's having that type of low back pain?
Well, a person who comes in and says, well, I have low back pain, and again, let's divide it up into acute versus chronic. After 3 months, it becomes chronic. One is the approach basically the same with some variation. The first thing, again, is to define exactly how we got here and where specifically is the origin of the problem. If it is indeed in a muscle, if it's been a muscle strain, then, as Dr. Horan suggested, there's rest and there's elevation and there's icing and all those sorts of things that you do to sports injuries. And time will take care of it, probably much as you experienced. If, in fact, in your analysis or in the diagnosis process, you go, it's something deeper, if it is a ligament, for example, around, let's say, the sacroiliac joints, which is very common, that pain will refer to other areas, and it becomes confusing if you don't fully understand that process as to which ligament it's coming from and where. When you do, Then you begin the process of making sure the joint is functional, and then providing some specific exercises to help heal or retrain that ligament.
So it sounds to me like, obviously there are many muscles in the lower back, and you can have a muscle strain, and it sounds to me like there are many important ligaments around the pelvis and the lower back, and they can get a micro tear or strain or sprain. And sometimes, I guess, to patients that can be confusing, like what's causing their low back pain.
It is very confusing, not only to patients, but to practitioners who are trying to sort these things out. Many patients will go to a variety of specialists, and to orthopedic surgeons, to chiropractors, to physical therapists, and so on, to try to find out, because it is complicated. And so I spend my day, you ask how I spend my day, that's what I spend my day doing. I have people who fit that category, and I spend a lot of time doing just exactly what I described.
Well, Dr. Nicodemus, as we know, that there are stores and retail establishments that only cater to people with back pain. It's amazing to me how common this is. So with something so common, are there strategies or tactics that people can keep in mind to prevent low back pain?
Yes, there are. One is there's an adage applied to so many things, but it applies to this too, and it's use it or lose it. And I'm speaking about muscle in particular. Muscle tissue, muscles themselves are organized such that they control movement around a joint. They also protect the joint, including the spine. So if the muscles are not in tone, that is, they're properly strengthened, and if they're not in balance, left to right, or opposing, front to back, there will be a strain or a sprain down the road, simply because they get overloaded, one side or the other. So be active and be mindful of your posture, how you lift, and how you move. And that's especially true as you begin to get into the third, fourth, fifth decade of life.
Okay, Dr. Nicodemus, what about stretching? And there are also these exercise routines. Of course, I've heard people say, and smart people, I've heard doctors say, if someone does yoga regularly, they're very unlikely to get low back pain. And then I hear about these, I think they're called Zumba classes, and then I hear about Pilates, where I think that's a process where the core muscles are strengthened. Do you find that activities such as yoga or Zumba or Pilates, can that minimize the chance that someone's going to get low back pain?
Yes, very definitely. It fits into the idea of being active and training and working with your muscles. Yoga, it's really important that when one thinks of yoga, one thinks of a meditative type yoga. We're not talking about the power yoga kinds of programs where you're forced to do things in a very dramatic way. So stretching is wonderful because it adds to the health of the muscle. Strengthening is also. The dynamic aspect of Zumba and some of those other things, which, Lord, I wish I could do, but it's been a long time since I would be able to do those, are very helpful if done, if introduced slowly, and there's some incremental change over time, not just jump in at level 10 and start going with it, because that will induce some strains and sprains.
Okay, so it sounds, something you said, use it or lose it. That sounds like it's one of the keys to minimizing the chance that someone will get low back pain. Dr. Nicodemus, once again, we're coming to the point where I have to, unfortunately, end up this segment. I hope you come on again, because this is fascinating to me. Let's let our audience know, are you taking new patients?
Absolutely.
And your services can be partly covered by common insurance plans?
Yes.
Okay, so Dr. Clarence Nicodemus, you're here in Monterey. You have a PhD in biomedical engineering, and you have your medical degree that was awarded in 2004. You're board certified in neuromusculoskeletal medicine.
Yes.
Now, do you have a website? Do you have a phone number we can give out if people are interested in learning more about low back pain or any other issue in
Sure.
osteo or neuromusculoskeletal problems?
831-644-9614. Our website is www.montereyclinic, all one word, .com.
Well, that should be straightforward. Dr. Clarence Nicodemus, you're board certified in neuromusculoskeletal medicine, 831-644-9614.
Yes.
And the website is montereyclinic.com.
Right.
Dr. Nicodemus, once again, thank you very much for being here. I hope you
My
can
pleasure.
make some time to come on again.
I will. I hope to.
Once again, this is Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon. We're coming right back after a very brief pause for a very good cause.